I hope you all are doing well and learning the muscles day by day and practicing it. When you're trying to get into your poses, just try to feel the muscles. This is the easy way, guys, to learn the muscle, that if I'm in the pose, just repeat one muscle in your mind, just revise it and feel that if I'm going in any pose, what is happening to my quadriceps, what is happening to my hamstrings. That way, we can easily learn the muscles in an appropriate way, guys. Now, the gluteus maximus, the today's muscle, the butt muscle that we call the gluteus maximus. Glutes we use for butt, for your buttocks from the back part of your pelvis or the hip bone. Maximus. Maximus is for your maximum, because this is occupying the maximum space on the back part of your hip bone. So glutes for the buttocks and the maximus because it occupies the maximum part on the back of your hip bone. Action, if I talk about, action is hip extension and abduction also. Main action is the extension, but it also supports a little bit in the hip abduction too, my friends. So insertion is a little bit tricky here. We can say insertion, it attaches to the outer part of the femur. It attaches to the outer part of the femur here. So muscle is coming from here, from the back, and wrapping like this way and attaches to the outer part of the femur. And most of you, I think, aware of this term, IT band. IT band. So IT band, it's not information technology band, right? This is iliotibial band. But the people who works in the IT, more sitting jobs, always have tight IT band, right? Tight IT band. So if you are working in the office desk or sitting job or IT work, please don't forget to stretch your IT band every day. That we'll discuss later. I will tell you guys, right? So IT band is the iliotibial band. So iliotibial band, iliac is this region. It is going from here. So one fascia, the deep connective tissue, the fascia that is going from here, from my iliac part, and this is the outer part where you find your pocket. This completely goes and attaches to the tibia. So a deep connective tissue, a thick fascia underneath the muscles that we call the IT band. So here that muscle connects. And the action is the hip flexion, hip extension. Like if I'm going here, this is the hip extension and abduction. So hip extension and abduction. So abduction is away from the midline of the body. Away from the midline of the body, guys. Sometimes when you're not able to try to extend, sometimes you have seen people try to walk like this. They are just throwing the pelvis forward. Weak glutes. Weak gluteus maximus. That causes this movement. If you have tight gluteus maximus, problem with the flexion also, right? Forward bending creates problem. Problem with the adduction also, gently. But the main action of the gluteus maximus is the hip extension and hip abduction. So simply we can stretch when you're trying to get into the hip flexion like this way, and you're doing this, you can stretch your gluteus maximus too. So I hope, guys, this must be clear to you, that, and please avoid the over contraction of this muscle, because this is the gluteus maximus, suppose, and underneath the gluteus maximus, like this is the muscle, my fingers, and my whole hand is the muscle, and this pen is your sciatic nerve. So underneath the gluteus maximus, this sciatic nerve is passing. So in the backward bending, sometimes you're trying to get over contraction, like you're trying to throw the pelvis away, squeezing the butt. Sometimes it can damage your sciatic nerve, or it can compress your sciatic nerve. That's why I always ask to my students that when I'm going for the chair pose here, never be asked to tuck your tailbone in, tuck your tailbone in. Sometimes over contraction of the glutes create compression to your sciatic nerve. So it's easy, guys. If you want to get, don't use the bone, use the muscle. Ask the client, just I am in the chair pose, suck your belly in. As you're trying to suck your belly in, if you have a high arch here, suck your belly in, suck your belly in. So this is the rhythmical movement. Movement has to be in rhythm. It doesn't mean you're trying to force the bone over there, trying to force the bone. So sometimes over contraction of the muscle, overloading on the bone, and that can compress your sciatic nerve. So be careful with the beginners, my friend. So I hope this must be clear. The origin from the pelvis, insertion to the IT band and femur, action is hip extension and hip abduction. So stretch your glutes every day if you have a sitting job, right? Because extra pressure comes here. So overuse. So try to stretch it every day and release the stiffness from your buttocks and from your glutes. For today's class, we are going to discuss about the muscle, the glutes, the buttock area muscle, the gluteus maximus. So glutes is for your butts and maximus because it occupies the maximum part on your buttock area. So gluteus maximus, as we have discussed, can you face that side please? So gluteus maximus, this is originating from your center of the sacrum, from the back part of your pelvis and going like this way. Can you face that side? So it is going from here now. So starting from here and my fingers like this, is the muscle is going over there and attaches to the outer part of the femur, IT bend, iliotibial bend, right? So starting from here, from the pelvis, the back of the hip bone, going like this way and attaches to the outer part of the thigh bone, that is your femur, and the IT band, the deep connective tissue, that is your fascia. So action of this muscle is hip extension plus, yes, hip abduction. Hip extension plus hip abduction. So can you please lay down on your belly? So if you see the muscle here now, it has to be relaxed. The muscle is also responsible for when you are standing. If it is weak, you drop your hip forward. So this is the muscle going from here to here. So action of the muscle, so bring this leg up, back, and bring it out. So this is the extension plus abduction. You can feel the contraction here too. The gluteus maximus. Release. So the muscle engages and stretches, that we'll discuss later. But first, how to stretch this muscle. This is the main component. So lay down on your back, on your spine. The simple stretch that you can do it, just try to touch your knee towards your chest. That's it. Make sure this leg has to be active, not lifting up the knee from here. This is the one basic stretch we can do. Hold it for 30 to 60 seconds, 3 to 5 repetition. Make sure you don't have to avoid your stomach or the belly here. No extra pressure on the internal organs. If you feel like that, you can slightly take it out and try to touch towards your same shoulder. Release. Then you can do the figure of 4 stretch. Bend this knee also. Place this here. And just bring your hands underneath your thighs, the back of your thigh, and stretch like underneath your thigh. And stretch like this way. This way also you can stretch your gluteus maximus. The good stretch for sciatic nerve compression too. Right? The good stretch for the sciatic nerve compression too, because the sciatic nerve going just below the gluteus maximus. So sometimes over tightness compresses your sciatic nerve too. So over tightness in the gluteus maximus, sometimes it compresses your sciatic nerve for a short duration of time. Release. So 30-second hold, 3 to 5 repetitions. Can you come to your belly again, on your belly? So that's the problem that happens sometimes, because suppose this is the sciatic nerve, this is the muscle. So if I'm trying to over squeeze the glutes, this happens and pressure comes to the sciatic nerve. So that's why when we ask, just try to get into the cobra quickly. Come to the cobra quickly, as the beginners do. So this happens, guys. You're creating extra pressure on the gluteus maximus. So it can compress your sciatic nerve. Relax. Now go gently. So from here the movement is coming, then slowly muscle contract. It has not to be over contract. Make sure. So release the pressure from the glutes. It has to be contract, yes, but not over contract. So the muscle has to be engaged from this part first, then this part, lower back, then comes to the glutes. Otherwise, it can create damage to your muscle too and the nerve too. Release. So the backward bending, muscle contract. Come to the standing posture, please. So face that side. So if you're going for the backward bending, just try to go for the backward bend. So muscle engages here, right? Or if you're bringing your one hip backwards, muscle engages when the hip extension is there. Release. If you're going for the forward bending, so what is happening? Lengthening of the gluteus maximus. So in the backward bending, stretches. In the backward bending, contract. Forward bending, stretches. Release. So make sure if you have a problem with going for the backward bending, you can check the opposite muscle. If you have a problem with the forward bending, check the glute tightness, check the hamstring tightness. So because of the sitting job nowadays, it gets overused. So don't forget to stretch it every day, my friends. Simple stretches you have. Take 2 minutes, 3 minutes from your activity of daily living and stretch your glutes every day. Till then, enjoy. Namaste. Have a nice day.